Bismillah ar-Rahman ar-Rahim. Good morning, everybody, and hello everywhere in the world, my friends, my fans, and my colleagues, and my patients, and my students. Today, I will speak about an important issue and topic, which is clinical practice. The reality of clinical practice. Clinical practice and clinical decision making does not depend on high technology or high tech. It's not the issue of high tech, it's not the issue of virtual reality. It's not the issue of using too complicated techniques and too complicated machines and sophisticated diagnostic tools in order to reach to diagnosis, or to use high tech in therapeutic modalities, in new therapeutic modalities, and in pharmaceutical industry, the biologics, the immunomodulators, the injectables, the interventional radiology, the drugs sent by embolization in cancer therapy, whatever the high tech is. So it's not the issue of using high tech in clinical practice to be a skillful clinician and to be a good doctor and giving the patient a good treatment and helping in improving the health care. The issue in clinical practice and the core of clinical practice is that the physician or the surgeon should understand the art of medicine. So the issue is not high tech. The issue is that clinical medicine depends on art, on skills, and on common sense. This is very important, the common sense. We have knowledge, but we don't have common sense. Most of us do not have common sense. We should have common sense in clinical practice. In order to reach the diagnosis may be picked up only by one small thing, by observation. Observation might be an important skill to pick up the diagnosis. And we avoid using too much complicated diagnostic modalities or asking for MRI or spectroscopy or high resolution CT or whatever, or angio or whatever technique. It is observation. And observation, as explained before, is a skill. It's a skill. So the skills in clinical practice, and among them is the thinking skills, and observation is very mandatory. Of course, clinical practice depends on, number one, basically there should be knowledge, which we call it the medical knowledge, the science of practice, the science. You should have science. You should have studied medicine well. You should have got the medical sciences, the basic and the clinical sciences. And then this is the knowledge. But more important than the knowledge is the experience, the expertise of practice. And here is the experience, and experience is the same as the wisdom of practice. This experience gives you the wisdom, and the wisdom is not less than the knowledge in clinical practice and in clinical decision making. So we should have wisdom of practice. We should understand the wisdom of clinical practice. And this is intimately related with the experience. And experience is related to how many years you have been in the field, in practice, and also it depends on your clinical skills acquisition and your clinical talents and abilities, including the talents of observation, the talents of proper clinical thinking. And the thinking depends on the knowledge, and not only on the knowledge, it depends on imagination, because knowledge is limited, but imagination encircles the world, as we say. Knowledge can take you from A to B, but imagination can take you everywhere. So in my opinion, even imagination as a source of logical thinking, as we say in logics and in philosophy. Imagination should play a role in clinical thinking and in clinical decision making, because imagination is more wider than knowledge, just knowledge. You must be a knowledgeable physician, yes, but more important to have a power of imagination in order to give you freedom in clinical thinking and in clinical practice, and in putting an overview about the clinical possibilities and the clinical differentials, and how can you reach among all these possibilities and the differential diagnosis to the definite or the final diagnosis. So this is the skills. Skills are very important. Observation is very important skill. To listen is a very important. To listen to the patient, which is absent in many medical settings, in many hospitals, in many clinics. No one listens to the patient. They are all in a hurry to finish as much as they can a number of patients. You have to focus on the quality, not on the quantity. Here is the absent pillar in the clinical practice, sorry to say that they care about number, they don't care about quality of service. The quality is the most important. I am a quality doctor, carrying on and doing and giving a quality service, which is very important in order to be a good doctor. Not just to get money, because medicine is not a trade, medicine is not a commerce. Forget about what's going on now, what we call the medical commerce. Sorry, this commerce corrupted the profession of medicine, the real profession of medicine. It didn't improve the health outcome of our patients. It improved your money, it improved your pocket, but it didn't improve the life of the patient and the overall healthcare outcome in the community and in the society. Clinical practice depends on skills. Clinical practice more again in reaching clinical diagnosis and putting a proper clinical decision and wise clinical decision. It depends on skills, and this is the art of medicine. To put the patient under observation is the art of medicine. Don't be in a hurry, especially in chronic cases and some subacute cases. In acute cases, the issue is different. You have to be aggressive because this is an emergency situation. So approach to an emergency in acute cases, aggressive approach is different or versus cautious and conservative approach in cold cases, different situations. These are two different situations in clinical practice. Under observation is very important, not only in chronic cases, also in acute cases. After emergency management and after first aid management, we have to put the patient under observation, and then stepwise for every step we give the proper management and the proper treatment depending on what you observe in the clinical progression of the case. This is very important. Under observation is the art of medicine, as we say. It is the main art of medicine because time reveals everything. What happens during under observation? You give time to you give time to yourself to be able to reach to the wise clinical decision and the most probable diagnosis, because maybe from the first spot you cannot reach the proper diagnosis from the first sight. You have to wait till time reveals the nature of the underlying pathology the patient is suffering from. Is it acute MI or aortic dissection? This is very important. Clinical skill is very important in order to reach the diagnosis, and common sense is very important in taking the wise clinical decision. They are more important than high tech. Common sense, art, clinical skills. Give yourself time. Try to be a quality doctor, not a medical trader. Thank you so much. Have a good day. Professor Dr. Tarek Ali.